Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with fibromyalgia? Find out more right now. Tonight's edition is a special one because a number of doctors at MedStar Georgetown, including myself, recently published a paper on interesting insights about the intestinal microbiome and fibromyalgia. I am interviewing this evening 3 of the senior authors. My first guest is Dr. Stavros Doumas. Stavros, welcome to Housecall.
Well, thank you for having me.
Yeah, our pleasure. So briefly, tell our viewers about your professional background, particularly what you're doing at Georgetown.
Absolutely. I'm currently the internal medicine chief resident, and I have a special interest in gastroenterology. So I'll be pursuing my fellowship in gastroenterology, Northwestern, in Chicago soon. So I'll be moving from DC to Chicago in June.
How exciting. Congratulations.
Thank you.
So let's go to the topic at hand, fibromyalgia. Describe briefly for our viewers what exactly is this condition?
Well, fibromyalgia is essentially a chronic condition that is characterized by a dysfunction in the nervous system, where the nervous system becomes hypersensitive to pain signals. So this hypersensitivity, and it's often called a central sensitization syndrome, essentially leads to widespread pain throughout the muscles and the soft tissues, along with other symptoms. Now, this is important because it is a condition that was identified a few decades ago, and our understanding has been evolving over those decades, and we're now making significant improvement. And a lot of people in the past have been undiagnosed or underdiagnosed, so I think it's really important to raise awareness about the condition.
Absolutely. Do we know what causes fibromyalgia?
The short answer is probably not entirely. We now have a good understanding about the different risk factors involved in the development of the disease. So there are multiple genetic, biological, or environmental factors at play. And the disease, it appears like it is often triggered by specific events, such as trauma, either physical or emotional. Chronic stress contributes as well. But then there are other things, such as infections, oftentimes viral or bacterial, that can lead to the development of the disease. So in short, there's no one single risk factor that can lead to the development of the disease, but rather a series of risk factors along with triggers can lead to the essentially dysregulation of the nervous system, as we mentioned.
What's interesting over the decades, as you point out, that we've been aware of this condition, is that it's kind of jumped from one specialty to another. There was a strong feeling that maybe it was a rheumatologic disorder, then perhaps an endocrine disorder, then perhaps an infectious disorder, and when all those things were disproved, even a psychiatric disorder.
Precisely, and I think the reason for it is that, intuitively, initially, it made sense, since the triggers were infectious, to think of it as an infectious disorder, or since the symptoms were mostly related to the muscles, to think of it as a rheumatological disorder. But I think now that our understanding is evolving and we are realizing that it's essentially a systemic disease, we've looked into other pathways involved in the disease development, one of which is, of course, the gut, which is the topic of today's discussion.
Absolutely. So who gets fibromyalgia? What is the patient demographic?
That's a great question. So essentially anyone can get fibromyalgia, ranging from children all the way to older adults. But usually most patients are women between the age of 30 to 60. Mm-hmm. And that's not entirely understood why that is, but there are probably some hormonal and genetic factors at play.
Are there certain risk factors besides gender that put people at risk for developing fibromyalgia?
There are several risk factors that have been identified. Predominantly, they relate to behavioral health disturbances such as mood disorders, depression, anxiety. As we mentioned, infection is another big group. But then obviously recently, especially over the past decade or so, other disorders such as IBS or irritable bowel syndrome has been strongly associated with the condition. And so taken together, those factors can increase the risk of developing the disease, but that doesn't necessarily mean that the people that have those risk factors will actually develop the disease.
What's interesting when you mention irritable bowel syndrome, and of course the topic tonight, fibromyalgia, is also the overlap with other conditions, depression, chronic fatigue syndrome, etc. There seems to be this constellation of symptoms that overlap with the common denominator we'll get into in the second half of the program, which is the intestinal microbiome. How common is fibromyalgia?
Well, more common than most people realize. It is reported that about 2 to 4% of the world population probably suffers from fibromyalgia. So a conservative estimation in the US would mean that around 5 or 6 million people have it. But obviously not all of them are actually diagnosed, and that's part of the issue, is that due to the lack of awareness and due to the fact that fibromyalgia is not easy to diagnose, a lot of people are not officially diagnosed and therefore suffer from the disease, but which is not addressed by a medical professional.
And share with the viewers what are some of the common symptoms.
So the major symptom is pain, and we're talking about a chronic, widespread pain that involves the soft tissues, the joints, and the muscles. The second major symptom relates to the fact that patients experience a profound fatigue that it usually is persistent, even though they could try to sleep it out, and then even after sleeping for a few hours, they wake up feeling exhausted. And then another interesting symptom is what is often referred to as fibrofog, so mental slowing or cognitive slowing, which usually manifests as decreased concentration, forgetfulness, or often patients refer to it as a decreased mental sharpness. So as you can imagine, all those symptoms contribute to have a huge impact on the patient's day-to-day, on the patient's work, on the patient's social interactions, but also on their ability to exercise.
Sure. And when you say they have muscle aches, explain in a little more detail what exactly are they experiencing?
Absolutely. So we're not talking about a discomfort. We're not talking necessarily about a mild pain, but rather a deep-seated, oftentimes severe pain that can wax and wane, and they can undergo periods where they have flare-ups in their pain, both within the same day, but also within weeks or months. And that pain usually is persistent. It's hard to treat with medications, and it's hard to figure out what the triggers are, but also what successful treatment options are as well. And related to that, oftentimes patients report stiffness, which is usually worse in the morning.
And have you found that patients may have extreme sensitivity, or even incidental touching of the skin can be experienced as pain?
Absolutely. So a subset of patients does experience extreme sensitivity, and it's part of the fundamental process going on in the disease. So the nervous system is hypersensitive to pain signals, and therefore any form of signal can result in significant pain.
So if our viewers are watching this program and they say, hey, wait a minute, I may have fibromyalgia, where should they go to get evaluated?
That's a great question. A good first step would be to get evaluated by their primary care physician. Their physician will be able to get a comprehensive history, perform a thorough physical exam, add potentially or some basic blood work and imaging studies. The blood work and imaging studies is mostly aimed at ruling out other conditions that can manifest in a similar manner. And depending on the results, then the primary care physician might be able to either diagnose fibromyalgia and then manage it, or potentially refer to the patient to a subspecialist, such as a rheumatologist or a pain specialist.
Sure.
It is important to, I think, underline that fibromyalgia is most effectively managed by a multidisciplinary team, which besides a primary care physician and subspecialist also includes a nutritionist and a physical therapist.
Excellent summary. So we're going to transition now to our next guest, Dr. Michele Fischer. Thank you so much for an informative interview.
Thank you.
If you smoked, get scanned. Talk to your doctor or learn more at savedbythescan.org.
My next guest is Dr. Michele Fischer, and we are discussing fibromyalgia. So, Michele, when we transition to your serving as our guest, I was discussing with Dr. Doumas fibromyalgia diagnosis and testing. So share with our viewers some of your thoughts about this.
Excellent. I'm happy to do so. So fibromyalgia is a pretty challenging disorder for some to diagnose, namely in that there is not abnormal lab or imaging studies in this type of condition. So that's why it's been hard to diagnose for some time. It's really a diagnosis of a clinical diagnosis, meaning that it's based on symptoms. But we know now what the symptoms are and when to suspect it. It should be suspected in those who have this widespread pain that we've been discussing, this hypersensitivity type of symptoms, and going on for some time, not otherwise explained by other conditions. So that's why your provider may do some testing, blood work, to look for other conditions like rheumatoid arthritis, thyroid disease, things of that nature to rule that out.
Okay. And tell us more about some of the clinical manifestations.
Sure. So a lot of the clinical manifestations could be, in addition to the pain, this deep fatigue, issues with sleep, mood conditions overlap often with anxiety, depression. People could have abdominal symptoms that could overlap with irritable bowel syndrome, such as lower abdominal cramping. So it's really could be quite broad, which I think is why sometimes it makes the diagnosis a little bit tricky at first, and people need to have a really high clinical suspicion for the disorder.
Sure. And what are some of the treatment options available that have been tried over the past few decades with mixed success?
Yes, so actually non-clinical or non-pharmacological treatment options are the cornerstone for the fibromyalgia treatment, at least up front. So those include educating the patient, giving them the expectations of what their disorder is, validating their symptoms so that there's a good rapport between the patient and the provider. That's step number one. And then additionally for that, doing cognitive behavioral therapy, that's been shown to be helpful, meditation, things of that nature. And then an additional pillar is increasing physical activity. So those are the non-medical treatments used for fibromyalgia. And then if people have more severe symptoms, need additional therapies, there are medications that we use, and they kind of come in three buckets. If patients have predominantly pain symptoms, they can be treated with a medication such as amitriptyline, which we also use in IBS syndrome as well. If people have more of that fatigue or difficulty with sleep, then medications like Lyrica, people may have heard of, or gabapentin can be helpful. And then if people have a mood syndrome overlap, like anxiety, depression, then medications that we use to treat anxiety, depression, like duloxetine, can be helpful. So those are the predominantly most commonly used medications.
Is there any role for things like acupuncture?
Yes, there are. So there's a lot of different lifestyle modifications that come into play as adjunctive therapies for fibromyalgia. Acupuncture has shown, has some benefit. But that's kind of a little bit hard to study, so evidence for that may be limited, but it's definitely something that could be used as well, in addition to music therapy, getting exercise, a good diet, all of those types of things that promote general well-being can be helpful in fibromyalgia.
How about yoga?
I think yoga can be helpful as well. Anything that gets the body moving can be very helpful. And specifically exercise, we recommend low intensity type of aerobic exercise, like 30 minutes 3 times a week, something like biking, fast walking, swimming, things that are, okay for the joints. Those are really good for people.
Sure. And what about lifestyle changes?
So going off of that, so in addition to the, those exercises, we could talk about diet, maintaining a healthy diet as well, maintaining a healthy weight. All of those types of things have been shown to improve pain overall.
And there is some data to suggest that stress may contribute to these episodes.
Yes.
So what do you suggest for that?
So I think a lot of the cognitive behavioral type of stuff is good for that. So mindfulness, meditation, and exercise as well. That all incorporates into this. This is not just one thing. It's people may need to do multiple things to kind of keep their stress under control, whatever works best for the individual. It's really an individualized approach.
Yeah. So taken all together over the decades that we've had slow progressive insights about fibromyalgia, what is your sense about how successful these treatments have been?
I think patients are left very frustrated with how the disease has been treated so far. And I think the big challenge is that it's not just a one size fits all type of medical approach. It's not, oh, I have rheumatoid arthritis and therefore I get a highly effective disease modifying agent that treats the inflammation, therefore I get better. People require different things depending on their symptoms, and not everyone's the same. So I think that's what's been really hard for managing these patients.
Sure. So finally, most important, tell our viewers, what are your plans at the end of your training?
So I'm going to be graduating my gastroenterology fellowship in just a few months.
At Georgetown?
Yes, at Georgetown. And then I'll be going on to remain within the MedStar system in the DMV area.
Congratulations.
Thank you.
And thank you for joining us on Housecall.
Thank you so much. It's been a pleasure.
We're going to pause briefly for a public service announcement. When we return, more on fibromyalgia. We'll be right back.
Okay, Dad, look at you.
I look nice, don't I?
I see you.
Adding your own flavor to fashion comes with age.
Oh man, that's the best one yet.
Forgetting how to add doesn't. Finding it difficult to work with numbers may be a sign of Alzheimer's.
Dad, are you okay?
An early diagnosis can help improve the quality of life for your loved one.
High school. Yeah.
Hey, Dad. Do you want to talk about what happened earlier?
Learn the warning signs of Alzheimer's. Some things come with age. Some others don't.
We're back. The topic this evening is fibromyalgia. My guest is now Dr. Ade Waterman of Georgetown Medical Center. Welcome to Housecall.
Thanks for having me.
My pleasure. So tell our viewers about your professional background and your plans.
Yeah, of course. So I'm from a small island in the Caribbean called Barbados. And I actually did my medical training in England, and I moved over to the US, to DC, for internal medicine training. And I'll actually be replacing Dr. Doumas when he graduates and finishes chief residency next year, and then eventually applying for gastroenterology fellowship as well.
Wonderful, wonderful. So the balance of the interview now is going to focus on our paper.
Yes.
So tell our viewers briefly why we came to the realization that the intestinal microbiome may be the so-called missing link to explain what's going on with fibromyalgia.
And you know what? That's exactly it, the missing link. Oftentimes in clinic, in internal medicine clinic, we have our primary care clinic, gastroenterology has their clinic as well. And oftentimes we would have patients coming in with symptoms of fatigue, irregularity, and it would often overlap with multiple other conditions like chronic fatigue syndrome and IBS. And with the emerging research currently, we said to ourselves, you know what, maybe there might be a link with the gut microbiome. So that's essentially the bacteria that live naturally within our gut that might be influencing patients' response to pain as well as their overall health.
Excellent. Now, our paper includes several illustrations.
Yes.
So you helped to put these illustrations together, so I know you have them pretty much committed to memory, but we're going to throw up the illustrations on the screen. And if you could, in layman's terms, explain briefly each of the images.
Yes, of course. Okay, so in figure 1, we have an illustration of the whole body, including the gastrointestinal tract, your muscles, your bone, but importantly, your central nervous system as well, which includes your brain and spinal cord. Mm-hmm. And normally you would think about pain sensation as in your brain to your muscles, but really and truly sensation comes from your central nervous system in terms of your brain and spinal cord. So your muscles and your bones send signals to your brain and your spinal cord. But importantly here, you'll see that the gut is also acting on the central nervous system here. And what happens there when the signals from your muscles and bones are perceived by your brain and your spinal cord, what we illustrate here is that the gut is actually influencing how your brain perceives that. And I think that's one of the really important things this diagram illustrates. Actually, even myself, when I was making it, it took me a minute to really appreciate how big of a deal that could be.
Yeah. And I will introduce an important word for everyone's vocabulary, not just physicians, but our viewers, and that is the concept of bidirectionality. Share that with our viewers what that means.
So bidirectionality would refer to how it's sort of a back and forth in terms of the muscles going to the brain and the brain going to the muscles as well as the gut, you know, how they both influence each other and essentially speak to each other. It's a conversation that they're having, and we as people, that's how we perceive our bodies.
Yeah, so it's not just the brain having supreme control over the body, but ironically the intestinal bacterial population communicating back to the brain.
Yes, exactly.
Yeah.
A conversation.
Yeah. So in our paper, we did talk about specific microbial shifts that may occur in the intestinal microbiome. Share with our viewers what some of those shifts were that we identified and what was surprising about all that.
Yeah, of course. The one thing that we found surprising was the bifidobacterium and eubacterium, which are essentially a class of bacteria that live within the gut, and they help to metabolize and create substances called short-chain fatty acids, as well as bile acids within the gut. And it was surprising that quite a few of the reviews that we saw and studies we saw showed that the number of those bacteria producing those helpful metabolites were decreased. And that seemed to be across quite a few of the studies we did that we looked at. So we were quite surprised by that, and really gave us direction or to pinpoint something to look at in terms of what could actually be affecting our bodies and that bidirectionality as well.
So that allows me to transition to the other diagram you put together.
Yeah.
Which goes over inflammatory cytokines, short-chain fatty acids. So describe that diagram, which we'll be putting up on the screen.
Okay, so in this diagram, you'll see here on the left side, you'll see the human body, and essentially we hone down into the actual GI tract. In the A part of the diagram, you'll see essentially a wealth of colors, and it looks like a healthy ecosystem, and that's what the gut is. It's an ecosystem. Our bodies are living with bacteria, and there's a symbiosis, and what that means is a beneficial relationship between them. So you'll see the bacteria in there creating helpful metabolites that help to maintain and regulate the gut's enteric nervous system, because essentially the gut has its own brain. And it's a large number of nerves that live there, and they need support, and the bacteria help to do that. Whilst on the B side of the diagram, you'll see it's not as varied. We have particularly harmful bacteria, which are essentially overgrowing. There's less diversity. The metabolites that normally are produced by the wealth of different bacteria, it's not there. You'll see there are not as many nerves. The gut lining, it doesn't have as many helpful cells that help to bring nutrients into the body. So it's a pretty good illustration, I mean, in my opinion at least, that represents what happens and the shifts that we saw in the studies that we were looking at.
Very interesting. So how does this then translate into what our patients are experiencing? The pain, the fatigue, depression, brain fog, what have you?
So again, it's all about that bidirectionality that you mentioned. We know that the sensitization that happens in the gut affects how our bodies perceive things. And we know that a lot of these neurotransmitters that these bacteria make actually get absorbed within the body and help to regulate our mood, how we feel. And when you lose that regulation, the number of neurotransmitters, essentially, it just makes you not feel great. Your body doesn't have what it needs, and it's something that we're looking at right now to see what in particular we can change about that. Is there anything that we can target?
All right. So we only have a minute left, but briefly, given these insights about the bacterial population and the GI tract, what kind of treatment options are we looking for in the future?
No, that's an exciting piece that is missing as well. The gut is host to over 70 trillion bacteria, and it's really exciting in the age of artificial intelligence. We're able to really pinpoint patterns that might be not as beneficial for patients. So we might be even able to create targeted microbiome transplants or targeted treatments for that. Some studies show that certain diets are helpful. You know, that's the fastest and best way to affect your gut microbiome is through your diet and through ancient grains and other things like that. Some studies showed some benefit with that.
Wonderful. Well, thank you for an excellent, informative interview.
Thank you very much. Thanks for having me.
My pleasure. My thanks to my three excellent guests, Dr. Doumas, Dr. Fischer, and Dr. Waterman. If you, the viewer, have any questions about this program, you can reach me at the station website, mmctv.org. As for our next show, it's going to be a very exciting one. Dr. Maria Petru, an interventional radiologist, will be discussing a paradigm shift in the care of patients with cognitive impairment. See you then next time for another edition of Housecall. Good evening.